Thank you so much for the invitation. As I had shared with Pam when she reached out to me, I was an Alliance member for several years. I know how hard the job of being a family member and supporting physicians in their work is, and then I know many of you all also are holding down your own careers and jobs and duties as well. So I wanted to start with just what is uncertainty, because Pam had mentioned that this is a theme that has come up a lot in y'all's leadership discussions lately, and so there's this kind of textbook definition of not being able to be relied on or being not completely confident or sure of something. And then there are the other words that we use and kind of to describe uncertainty. And I thought synonyms were important because unpredictability and unreliability make a lot of sense. But then disquiet was on there, and I think that is the thing that a lot of us are feeling right now, right? Is that since that lack of peace, that lack of kind of comfort and apprehension. This definition that's in the bottom, I think, is nice because it kind of ties everything together. It comes from the University of Michigan Department on Psychology, and it really talks about how when you're uncertain, you have like limited knowledge about something and limited ability to have control, to plan, to predict the future outcome, and how that can lead to distress or stress, right? We are creatures of habit, and most people prefer to have a plan or routine in place. And so when we feel like we can't control plans, or when things happen, it can feel like losing control, and that really can result in anxiety or stress. So I made a word picture that to me included a lot of things that I felt, or that I'm hearing from patients, friends, and family and colleagues about COVID. This is my first attempt at a word picture, y'all, so I was real proud of it. but I think that a lot of the things that you guys just mentioned, health, worry, scarcity, anxiety, are on there. Again, as the mom of teenagers, distance learning was a huge one for us, right? As we made that challenge. The financial pieces, the unemployment, furlough, looking at kind of where, is the next paycheck coming? Are we going to have to, I have several friends in private practice who had to consider dipping into savings to make payroll before, as they were waiting for their payroll protection plan to come in, those types of things. And I think what is unique about the uncertainty about COVID is, and what I hope this picture captures, is that COVID has been a piece that both affects our entire country, so everyone is going through it at the same time. So as opposed to many of you all probably have dealt with hurricanes, flooding, tornadoes, natural disasters. Texas is a state that unfortunately has our brunt of those. But often it's a small located geographic area that is, and then there's this surrounding area and even the surrounding country that helps kind of rise to the occasion and support. And so that has been one of the things that's been particularly challenging about COVID, is that really is affecting everybody. And then the other piece is that it's affecting really every part of our lives. So I think about a family that I had earlier last spring, whose home was destroyed in a tornado just east of the Tyler community. We have a strip there where we've had several really significant tornadoes in the last few years. And that was really difficult and traumatic for their kids, but they still went to school every day, right? They had their kind of stable set of friends. Their church really rose up and surrounded them and was able to support them. And so many of those pieces have been, right now, not only is home life different, but school is different, work is different. And so that, I think, has been a real challenge. And then particularly when it comes to healthcare professionals and uncertainty around this time, I think a lot of it is that there's so much about COVID-19 that we don't know, right? And every day, I feel like I'm learning new things, and sometimes they feel like they contradict what I knew 2 weeks before, right? So that uncertainty as a profession and as a group of people who really focus on providing evidence-based care and wanting to do what evidence tells us is best and right for our patients, that is a really challenging thing when you feel like you don't know what the right answer is and you don't have that evidence, which leads to a lot of uncertainty with physicians. And then the other places where it's led with uncertainty for physicians, and as a single mom, this has definitely been the case for me, is that concern and risk about if we are seeing patients coming home to our families, and are we bringing this illness potentially into our home? We'll talk about that a little bit more when we hit routines, but I think that's been a particularly hard piece. And then looking at so many of my physician friends whose care focuses on what are considered elective procedures, but we know really aren't, for the most part, elective, right? But that were postponed for such a long period of time, and the financial implications for that. I have a lot of colleagues who have been furloughed for periods of time. Our largest health system here in Tyler went on basically a 1 week out of every month, was furloughing most of their clinical staff for April and May in order to be able to, kind of financially stay afloat during the time. So big picture here is that this uncertainty right now affects kind of every part of our lives, and it affects everyone in different ways. Oh, did I? I was like, there you go. So then what's stress? We mentioned that uncertainty can lead to stress. So the definition of stress is pretty simple. It's the state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. I think we would all agree these are adverse circumstances. I will say, as I was making this slide, I Googled for a picture on stress, and every single Google image had someone doing this, right? Like either hands down or hands over their head, holding their temples. So I think one good indication, if you feel like you are like, am I stressed or not? If you find yourself doing this, that's a good sign physically that it's happening. It seems to be the universal sign for it. But what stress actually does to our body, it stimulates our neuroendocrine system. And I will not get in the weeds of all of the kind of changes that happen, but basically what happens is you release a set of hormones. Some of them we know very well, and people always think of adrenaline or epinephrine, that fight or flight syndrome, where when you're under an acute piece of stress for a short period of time, your heart rate goes up, you feel little butterflies in your stomach, right? Your blood pressure may go up, those types of things. But then when we have stress over a long period of time, we release a hormone called cortisol, and we release it all the time, but we release it at higher levels and more sustained. And that really can cause some kind of prolonged effects. It can make our immune system not as responsive, so it can make us more susceptible to getting sick. For children and adolescents, it can actually affect their brain development, so it makes parts of the brain not grow as robustly that are involved in things like self-control and emotion regulation, and then it makes parts of the brain actually hypertrophy or overgrow that are those primitive reflex survival instinct parts of the brain. The amygdala is what that's called. And we know over time it also can affect other parts of our body, right? It can affect long-term our cardiovascular health, our blood pressure. It can affect long-term how our liver functions, how our kidneys function. So stress is something we think of as a mental or emotional strain, but it really does have very profound physical effects on our body. And then the next question people always ask is like, okay, so is all stress bad? Do I avoid all stress? And actually, that is not the case at all. Some stress is actually really good for us. So we call that positive stress, right? Positive stress, so I have a little bit of positive stress when I give public speaking, right? So right now I've got a little bit, my heart rate might be a little bit faster. But when you experience positive stress, taking a test is another kind of classic example of positive stress, and then you're able to meet that challenge and do well, it builds confidence and resilience and helps you develop coping skills. When we have positive stress, we don't need a lot of support to help us through buffering positive stress because our bodies are able and our brains are able to do that. And then there's this piece called tolerable stress. I feel like this is where a lot of people are right now. This is more serious. It's temporary, as in we know this isn't going on for forever, but it's longer than most incidences of positive stress. And the part of the challenge with COVID is we don't know exactly when the end point is. There's good science that tells us that people deal better with stress if they know an end point for it, right? So that's part of what's challenging about this is we don't have an endpoint yet for when either we'll have a vaccine or a sufficient treatment, or when COVID-19 will, dissipate within our communities. The thing that's important to know about tolerable stress is that the best way to manage it or handle it is to have the presence or buffering. This says of a caring adult because this is designed for, this is one of my pediatric slides, right? But true for adults, just buffering of a caring person in their life. So that's where our relationships and our networks are so important. And when we have tolerable stress, even if it's tough, and we have that buffering, we typically come through it much stronger, and we are able to deal well with it. But if you sustain tolerable stress for a long period of time, it can still have some of those physical and neurologic changes that I was talking about. And then there's the stress that worries people, it keeps pediatricians up at night, right? And that's in psychiatrists and family practice docs and a whole bunch of other people, right? And that's the toxic stress. And toxic stress is kind of categorized by two things. It's the intensity and the length of time that it lasts, as far as the type of situation. And then the other piece is that it exists without that buffering system, without the caring, supportive relationships. And we know that when people undergo toxic stress early in life, and when I say early in life, most of the research has been done on children and adolescents, but we have some good evidence even for 20, 30-year-olds, right, through adulthood, into adulthood, that we see these lifelong health consequences from toxic stress. Increased rates of alcoholism, effects on memory and learning because of the changes in the brain, increased incidence of chronic diseases that many of your loved ones are taking care of every day, heart disease, cancer, other chronic diseases, and then also mental health issues such as like anxiety and depression. So the good thing is, when you think about when you're stressed, because a lot of us say I'm stressed a lot, right? Trying to help categorize, okay, where am I on this stress spectrum? And what can I do to move something if we're hitting that toxic stress? For example, what can I do to move it back down to tolerable stress? Or if it's tolerable, what can I do to move it back down to positive stress? We're going to talk about some of those techniques here in a minute. And then, so let's talk a little bit about how we respond to stress and uncertainty. So the first thing is that we have coping mechanisms. So I'd like to use the chat box again. And if you guys have coping mechanisms that you either know of or that you use personally when you're dealing with stress, if you will put them in there. Praying, absolutely. Working out and exercise, yep. Sewing, being creative. Breathing, oh, whoever said breathing is going to really love me in a minute because we're going to breathe. Exercise in downtime, walking, hiking, breathing, taking a walk. You guys already know all the answers, right? Friends, puzzles, I love puzzles. Exercise, yoga, exercise. So I will tell, just personal confession, I am not really an exerciser. And one of the things I have done during this time is try to make myself just take a walk every day, right? Because I don't love exercise, but I know how important it is. Drinking water, breathing and golfing, gardening. Okay, we're gonna hit on that one too. Mindfulness, absolutely. So those are, everything that somebody has mentioned is a healthy coping strategy, which is great. I'm glad you guys have a bank of healthy coping strategies to start with. What are some unhealthy coping strategies? Wine, okay, so absolutely, we have seen online alcohol sales have gone up like 450% during COVID. And yes, bars were closed, but that tells us something, right? And the liquor store sales also went up. Smoking, drinking, screen time, yeah. Eating, confession, I was in a bowl of Bluebell before bed every night for about the first 6 weeks of this, and I finally had to stop and be like, wait, we've got to reset that. Eating is one of those things that can actually be a healthy or an unhealthy coping mechanism, depending on where you are. Eating too much, unhealthy eating. Anger, yeah, so that's what, losing our tempers, right? Lashing out at people is another one. Endless time on Facebook. I keep telling my dad just to put it down, right? Binge watching TV series. And that's one of those that I think if you're doing it in a way that is not taking over, may be a reasonable thing to do, especially in a time when we're stuck at home. But if it's all that we're doing, and we're going to talk about how we know whether we're seeing some unhealthy spots or not, that can certainly be an unhealthy piece. Okay, you guys are great. We're going to add some more to that list hopefully here in a minute, but these are really good places to start as far as the healthy mechanisms. And then those healthy mechanisms build what we call resilience. And resilience is that ability to quickly recover from difficulties. And that is the goal. We cannot change the situation that we're in right now as far as the stress that we are experiencing, what's happening in the world. But if we can use this time to build healthy coping mechanisms, then not only will we be more resilient right now, but that actually gives us a toolbox in the future, right, to continue to be resilient. I think that's especially important for our kids right now. So if you are a parent or a grandparent, or have access to helping kids employ some of these mechanisms, but really true for adults too. Sorry, it gets mad at me. So let's talk generally about this, like ways to promote resilience. And we're going to start actually in the middle at this area that says for everyone, because it applies literally to everyone. So several of these we already heard, right? Walk in the woods, right? Some of you guys may have more woods than others. I get to live in Tyler where I have wonderful woods, but just generally that means getting outside, spending time in nature, right? One that we didn't mention, but I think is really helpful, is practicing gratitude. Thinking every day consciously about things that we're thankful for. Exercise was mentioned a lot. Healthy foods can, again, be resilient. Somebody mentioned art. Music is another great one. Volunteering is one that I know that Alliance members do a ton, right? You guys are amazing volunteers. Sometimes this has been a challenge during COVID of what you can do. Are there things you can do from home? You know, are you safe doing those volunteer things? But doing something where you kind of get outside yourself and help someone else. For children particularly, again, being those supportive adults, focusing on where they are in development. And then for adults too, and we'll talk about these a little bit more, who are dealing with more significant issues, you know, mental health resources, and seeking support. And so one of the things that Pam and I talked about when we were talking about the concept of this conversation was that it would be helpful if we had some really practical things. So this is a great graph and gives you some general ideas. But I think one of the things that I find a challenge sometimes is that self-care and this piece of wellness and resilience building sometimes feels like it's work in and of itself, right? And sometimes it feels like I'm like, I don't have time to do these things. And so one of the things that has been really helpful to me and that I build with patients is figuring out what are the tiny little things you can do if you have different increments of time. So we've mentioned a couple of these, but so if you have 1 minute, like we all have 1 minute, right? We're going to use a minute here in just a minute, as a matter of fact. But so if you notice, laughing was on that one. And I know that seems like really silly and simple, but when we smile and laugh, we actually release serotonin, which is a happy neurochemical in our brain, right? And so even if you don't feel like smiling, find something funny, put a joke on. So I would say one of the things in Netflix that might be good self-care is a comedy special that you like a lot, right? It's also a one-off thing that you can do for a few minutes, but just taking a moment to smile or laugh. And then breathing exercises. Several of you mentioned breathing. So, and there are tons of other ones out there. There's also an app that can help with breathing exercises called the Calm app. It has, there's some paid portions, but the breathing portion you don't have to pay for, it's free, and helps you count out breaths, uses a circle, and can be really helpful. And then if you have 15 minutes, some things to try. So one of the things that was on that list, that resilience list that we looked at earlier, that we didn't come up in ours is music. And so for some people that may be creating music, playing an instrument. I love music. I am not super musical, right? So just listening to your favorite song, and actually if you have 15 minutes, you could probably listen to a few of them, right? That gratitude list we mentioned earlier. And then during this time of social isolation, I think that reaching out for friends and calling somebody. I like to talk, so sometimes 15 minutes isn't enough for me, right? When I am reaching out to connect with a friend. If you have 1 minute, just shoot a text to a friend, right? And have a couple back and forth with the text, just to help build that connection. And then if you have an hour, so we talked about taking a walk, we talked about exercise. Right now, sometimes that's been a challenge for people because they like to go to gyms and they were closed for a period of time and now are limited capacity and those sorts of things. But there have been a real explosion of videos and online classes available as well. And then a couple people mentioned different kinds of art, which can be really important. Somebody mentioned knitting in their list. That may be different for everybody. I am not super artistic. I should have brought it in here. But what I've been doing as my creative thing during this time is I actually bought an adult paint by number, big giant tree of life, and we'll just spend 30 minutes, and so it doesn't take a ton of creativity, but it's that focus on something small and detailed and using my hands, connecting my mind and my body, that can be really helpful. And then we mentioned volunteering earlier. I think one of the things that's important to know is that these are great coping mechanisms and are helpful in general, but there are times when things are more severe than this, right? That listening to your favorite song just isn't going to cut it. And so what are some signs that you or one of the people that you care about are having really more significant mental distress and may need more help than that? So the first one is use of some of those unhealthy coping mechanisms that we talked about earlier. Alcohol and drug use. Recovery Village did a survey. They're a national sobriety organization, but they did a random survey of 1,000 people during COVID and found that 88% of people reported using alcohol at least some, and half of those who reported it said they were using more than they were pre-COVID. So this is definitely something that we're seeing. There's about a 39% increase in use of other drugs, both prescription and marijuana and things like that. So if we're using those unhealthy coping mechanisms, that's a sign. If it's interfering with being able to do our job or our daily life functioning, so that can be everything from like kind of keeping your household together, right? Like if the dishes keep piling up and up and up in the sink and we just don't have the energy or the focus to be able to, to clear those out, or if you find that you really can't, get out of bed in the morning and get to where you need to be. Intrusive thoughts is one that a lot But in general, those things that we used to enjoy should still give us pleasure during this time. And so if you or someone that you know is having some of those things, I did want to be sure and leave you guys with some resources for those things. So there's a couple of technology-based supports that are easy because you can literally put them on your phone right now. Wobot is an app that I really like. That uses cognitive behavioral therapy principles. You are talking to a robot. I mean, it's a computer algorithm, right, at that point in time. So it can be really helpful to change thought distortions and to help decrease anxiety. It'll have some breathing exercises built into it, things like that. But it may not be enough for somebody who really needs one-on-one individual therapy, because you're not actually talking to a person. It uses very scientific-based tools. It was developed out of Stanford, though. And then BetterHelp is one of many online platforms where you can actually do online behavioral health services. There are a host of other ones. The state of Texas recognized that this is a really hard time for people, and so they've actually started a state mental health line specifically during this time. The number is there, and we'll make sure that it's on a follow-up email if you guys get it. Obviously, you hopefully have local counselors and primary care physicians who are comfortable with taking care of behavioral health and mental health issues in case we need medications, things like that. And then if things are really bad, I do think it's always important. I don't really ever do a mental health talk without mentioning the National Suicide Prevention Lifeline and making sure that people know how to reach out. They are available 24/7, can help talk you through where resources are in your particular community, and will stay on the line with someone until they know that they're they've got another adult there to, to provide help or support, or they're in a safe place. And so that can be a really helpful thing. I give that out a lot at work, right, to my kids, even ones who aren't obviously suicidal at the time, but just because I want their families to have that resource of what happens if at 3 o'clock in the morning something gets bad at some point in time, right? And I may not be quickly available. And so those are just some resources if you are having really kind of some of that more significant stress. Most people that I've talked to are in that world right now of tolerable stress, but it's really the length of time that this is going on that may push it for some people into that toxic stress area where we're really dealing with some significant mental health issues. That is all of my presentation. Here, let me, just in case you want to find me, there's me on Twitter, and that's my email. But we wanted to leave a significant amount of time just to open up to questions so we could have hopefully a little bit more of a discussion about where you guys are now, what things might be helpful, or if there are other little tips or tricks that I can pass along. Let's see. I'm going to open the chat box and just see if there's anything there.
Hi, I was just wondering if you're in the tolerable stage, is it still possible? I feel like sometimes I find myself spiking every now and then into the other and going back again. Is that something normal?
Yes, so that certainly you can go from positive to tolerable and back, and both tolerable to kind of toxic and back. And really, again, the thing that is most common as far as kind of ways to move back down, right, into that healthy place is that buffering relationship piece. So having a person or multiple people, depending, right, who you can have some meaningful connection with. Now, one of the challenges I think for people is that often their buffering person is their spouse, which is great, except we have been around our significant others maybe a whole lot more than usual. And so some of that right now may be actually, I need 5 minutes by myself, right? Whereas opposed to before I kind of unload on you what I'm thinking or feeling or what's going on. But if you find yourself spiking, if you can identify one of those coping mechanisms and try it, and I will say the best way to use coping mechanisms is to use them when you're not at when we're not at a 10, right? To use them in our daily lives when we're at 1, 2, and 3, because then it becomes much easier to employ them when we're super stressed, right? If you never practice breathing and then you're super stressed and you're like, I'm gonna breathe now, actually isn't nearly as helpful as if you practice every day, and then when you start to feel stressed, you're like, my body knows how to do this, right? My brain knows how to do this. So practicing those techniques and then having some to call on can be really helpful. Martha wants to know when someone should get tested, and that is $1 million question. And I think part of it is the answer is depends on where you are. So, for example, where I am in the state right now, we are testing people with at least 2 symptoms. So if you have fever and something else, right? Potentially we're testing, but we're not for routine outpatients testing with just 1. We are not seeing a ton of cases. If you live in Harris County, that may be different for where you are. Certainly anybody with symptoms consistent with COVID who's being admitted to the hospital needs to be tested. And then there's this question of, should people be tested who aren't sick? Some of the most recent data out of Texas Children's Hospital shows us that almost half of kids who've been coming in for elective procedures who tested positive, because not that many are testing positive, right? But half of the ones who test positive didn't have any symptoms, right? And so we know there are a lot of people who are asymptomatic. If you are asymptomatic and you're wondering if you should be tested, I think it really depends on your risk factors. So if you, for example, if you're asymptomatic and you are really wanting to go visit a family member who's a high-risk family member, that may be a reasonable time before you go. You do have to know that testing is at one point in time. So I could test negative today and potentially test positive tomorrow, right? So if you're testing when you're asymptomatic at that point in time, know that, like, if you're doing it so you could go visit somebody or something like that and feel more comfortable, you really have to quarantine or isolate between then and when you get your results and when you actually go to see them or visit them. People ask about antibody testing a lot right now. We do not know whether positive antibodies tell us that we've been exposed. Right, we don't know that positive antibodies confer immunity necessarily. So getting a positive antibody response doesn't mean you go back to life and don't social distance and all those things exactly the way it was before. We still need to be cautious and thoughtful kind of throughout this. Yes. You guys are welcome to. I think the follow-up email will include my slides, and then I know that a recording of this talk is going to get posted. So somebody was asking if it's okay to share the slides with some of their staff. And so that absolutely, Pam, I don't know if she's back on or not, but hopefully, I know she's not doing that.
Yeah, I'm here. We will be posting this online on our website, and we do have the slides that you've sent us. So we can make that available to everyone afterwards.
Yeah. Somebody asked about locating quick test centers, and I will say that the Department of State Health Services is doing some testing across the state, like in different communities on different days, and so that information can be found at the DSHS website as far as that goes. And then there are other, like, private companies have been doing some, so CVS has some quick testing sites and things like that. Those I think you have to go to find. I don't think there's one unified place to find those. You'd have to go to like CVS's website and look and see where theirs are.
And I'm here, Valerie. So.
Oh, great.
Great presentation.
Oh, thanks. Appreciate it.
I've got a question.
Yes.
Hi. So my daughter lives in Boston and she's in her 40s, and she probably had it because she had all the symptoms, the chest pain, the breathing, etc. Couldn't get tested. This was early in March, so it was at the beginning of all this. Anyway, she still has low-grade fever.
Has she, so my first caveat is always anything I say is not replaced by her own, right? Physician who knows.
Understand.
I have friends all the time who ask me questions about their kids' health, and I'm like, if any of this contradicts what your pediatrician said, who knows your kid and has examined your kid, you listen to them, right? But we do know that some people have an inflammatory reaction for a long period of time after COVID. Now, if it was mid to early March, that's a really long time, and I would really seek out, you know, seeing, yeah.
She's been, yeah.
Yeah.
She was there actually last week and saw her doctor, and he said he's been seeing this. She was also, when she finally was able to be tested, all they did was an x-ray because that was still early on. Mm-hmm. But then she was one of 1,000 random people who were tested with both the diagnostic and the antibody, and she was negative with both.
So one of the things that we do have to know is that while as a pediatrician, I have been seeing a lot less of many of the things that I typically take care of. Like, I can count on one hand the number of kids with gastroenteritis I've seen in the last month and a half, and usually that's like a day this time of year, right? I'll see that many kids who have that. We still, you know, especially when COVID started, we were still seeing flu significantly, especially on the East Coast. And so there are other, you know, other illnesses that may have been a part of it. But the reality is, if it sounds like she was far enough out that the nasal swab test, you know, may or may not, right, may or may not have been timed in a way that would have given you any results. And that is the big concern among physicians, and we've had a lot of discussion about this on the COVID task force, is the antibody test. There's a lot of variability. Some of them are very sensitive and specific, and some of them are not. And so we are really encouraging our physician members in Texas to use FDA approved tests, because there are a lot of non-FDA approved tests that have come to market as well. So some of that may depend on the test she had as well. I'm sorry she's not feeling well. Yeah. But this is a hard time to be dealing with, like, all the stress and then physical stuff on top of it, right? It's been a real struggle.
Yeah, she's also a single mom, so you know what that means.
Yeah, yeah. Thanks. I will also throw in, since we don't have a ton of questions or if anybody has more, since we have a couple more minutes, a few little things that I think are helpful, a few more kind of coping pieces. And one of them that I have found to be particularly helpful is trying to find pieces of self-care or enjoyment in normal parts of my everyday life. So for example, when I see sick kids in clinic, I come home, I take my scrubs off and I get in the shower, right? Because I'm coming home and I got to make food for kids and take care of them and do all those things. And I want to decrease my exposure. So one of the things I did was buy from my favorite like bath product company, some wonderful, like a shower mist and a sugar scrub and all the things that just made that not a chore, right? As in, oh, this is one more thing I've got to do because it's how I'm going to try to keep my family safe and take care of them, and really allowed it to become a moment of like calm and serenity. And I spray that stuff and I do a breathing exercise and it's love, right? It's kind of a lovely way to start the rest of the day and kind of refreshes me for them, as opposed to like, okay, let me get in and out as fast as I can and just make sure I scrub all the germs off me. Right, kind of thing. So looking for those types of things. I mentioned that I'm not a huge exerciser, and so I've been walking, and I do love podcasts though, so that's part of my deal, is that if I go on a walk, I get to listen to a podcast, right? There are a few that I have found really encouraging during this time, and this is not an evidence-based piece the way some of those other suggestions I gave, but Brene Brown launched a podcast in like the end of February, and I think that the world knew that like we needed the voice that she has. She's actually where I first learned box breathing from. She's a wonderful sociologist from Houston. Her husband is a pediatrician, so I don't know if she's an Alliance member or not, but she should be. So somebody needs to do some work on that, right? So she does a lot of very evidence-based work around resiliency and communities of support and things like that. So that's been a really, really wonderful tool for me. But there's a host of great podcasts out there. I know a lot of people who've dug into podcasts on just random little topics they wanted to learn more about. The other one that we didn't mention on that resilience piece is reading can be great. If you're finding yourself doing too much screen time and you still want something that's kind of calm and quiet, you know, losing yourself in a book can be really, really fabulous. I don't see any other questions in the chat box. Oh, hold on. So this is a really good question. So somebody says, what do you do when you realize how alone you really are? In other words, you recognize that the support system you have or had is non-existent or is disappeared, right? So one of when I'm working with families who are in crisis, one of the tools that I was taught to start with is starting with like, who would you call in the middle of the night if you had to get somebody over because, you know, you had to go to the hospital or something, right? And most people can identify one or two of those people who are there, like, yes, they would show up if there was some giant crisis, right? And that's the beginning of that network. And then the next piece is like, who would you call or who would you like to call, right, the next morning? And kind of starting to break out those pieces. I do think if someone's at a point where they can't tell you, I don't know who that middle of the night person is, those are particularly places where it's important to to make sure they have some of those hotline resources, because that may be their middle of the night call, right? To 211 or to the suicide helpline or those kinds of things. And then I think the next question is, if you realize that the support system you thought you had isn't there, is what can you do now to help build out a support system for the future, right? And that's hard right now because it's not like we are getting to meet a bunch of new people necessarily, although we are now having a little bit more opportunity, at least in some areas, to spend time out and in community. So one of those, like the volunteering piece that came up with helping others, is a great way to meet other people who are interested in helping other people. And so especially if you're an animal lover, it may be the SPCA. If you are like me, passionate about food insecurity, it may be a food pantry. That may be a place to build some of that community. And then I don't know if this is particular to the person who asked or not, but community, and I don't, there's probably a very wide variety of faith backgrounds on the call, but utilizing a community of faith or becoming involved in a community of faith can be a really helpful piece there as well, to kind of start to build out that community, especially when you're new to a community. And somebody suggested audiobooks, and yes, I wholeheartedly agree. Those are my car drive. Like when we drove to San Antonio, that's how I survived those car drives.
Well, seeing no more questions, I want to say thank you so much for your time today. That was very, very helpful. And we have your contact information, so if people do come up with more questions, if it'd be all right, they might be able to email you.
Yeah, absolutely. And I'm going to plug, there was one more question about the income protection plans. So there are some really robust resources on the TMA COVID site. There's a whole section on practice viability, specifically walking through, and there's a couple of podcasts that have been developed on those, as well as like some webinars on how to apply for some of the income protection plans. And then for people who see patients who are on Medicare or Medicaid, there's a separate pot of money and how to apply for those. So if you have questions about COVID particularly, or practice viability, that is a really great resource. TMA has done an amazing job of building out things both clinically, but also on practice viability. Such a huge, huge issue this time.
I think there's one more question. Did you see that?
No. So masks. So my favorite graph right now, if I wish I had a picture of it, if anybody has seen it, is that shows kind of the chance of infection if no one's wearing a mask, if one person's wearing a mask, and if both people are wearing masks, right? And so typically the recommendation is you don't have to wear a mask when you're in your own home, but if you're going to visit somebody who's high risk, I think it is very, very reasonable to continue to wear a mask. We know indoors is more risk than outdoors. So like if you guys can meet outside and sit on the porch 6 feet apart, you may be that may be very reasonable not to wear a mask. But we remember that we wear masks not really to protect ourselves from getting sick, but we wear masks to reduce our chance of spreading to somebody else. Like I said, the data that's coming out now says that a significant number of people who have COVID are asymptomatic. There's also some data that suggests that it may be less common for people who are asymptomatic to spread COVID than people who are actively having symptoms, which makes sense. If you're actively having symptoms, there's a very good chance your viral load is going to be much higher, right? But I think that would be that wearing a mask, even if you're going to visit someone who's high risk, would be a very reasonable and, to me, a kind thing to do, right? Thank you guys so much for your attention and all the questions. And I really, again, it is like the work you do in your own jobs and your own work, but also in supporting your families is so important and so thankful. And physicians, we could not do our jobs if we did not have our families behind us. I mean, it's just not everything from medical education and surviving, medical school and residency to starting a practice to we could not do it without our families. We so value and appreciate you all.
Well, thank you again for taking your time with us. Just to remind you that we will have another webinar on July, I believe it's the 16th, but more information will come out on that. But again, thank you, Dr. Smith. This has been really, really helpful. And we appreciate your time.
Thanks. You guys have a wonderful day.
Bye. Pam, do you have anything else?
No, I think that was wonderful. And we would love to have any ideas that you may have on future enrichment series. We are going to schedule one of these every month. And we also have on the TextMedAlliance.org webpage, we have a page dedicated to our enrichment series. But we are looking for a few other ideas and speakers that you might want to have. So any ideas you may have, please email either myself or Sasha. We'd love to hear some future ideas, and we'll keep lining up speakers. So thank you everybody for tuning in today, and let us know what you think. I mean, feel free to email Sasha and I with your comments about today's presentation and any comments for future presentations.